want to bring into this discussion Amesh Adalja, Dr. Amesh, an influx of more patients. So what steps can places like Arizona
space so that they can take care of the patients that they're going to get? They may need to be more judicious about their scheduled surgeries, which are colloquially called elective surgeries, to decide which ones need to go forward, which ones they can postpone a little bit. They need to think about their staffing, their personal protective equipment, all of the same types of considerations we heard about in March. That has to be back into play now as they get inundated with cases. And then they have to work very strongly with their health departments at the state and local levels to try and stop this spread from occurring, get better at contact tracing, make sure that that's all robust, because that's the only way that we're going to get out of this, is by trying to keep those cases to a level that is manageable by the hospitals. And when they get in trouble, we're going to see these types of consequences.
Dr. Adalja, Dan Roberts here. In your expert opinion, as we look around the country now and we're seeing troubling numbers about spikes in cases, Texas had its highest number of COVID-19 hospitalizations that it's had since the beginning of the pandemic, I think on Tuesday. For people who are starting to think about traveling, especially if certain states are, reopened and restaurants are allowing outdoor dining, and in many areas even indoor dining, as long as you have a mask or as long as you socially distance, do you have any advice or caution? I mean, should people not be traveling? Should they not be venturing out to the extent that they have been doing so? Are states reopening too quickly, in your opinion?
So this is going to be something that's not a one-size-fits-all type of answer. It's really going to depend on the local dynamics and transmission of this virus, what's going on in that area, what do the hospitals look like, and what's your personal risk tolerance and your risk factors for severe disease. So the important point to remember is the virus hasn't gone anywhere. We really had enforced social distancing to preserve hospital capacity. So in many states,
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.